Hi, welcome to this unique haircut by Ipka. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when we used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Sonam Sharda. Gupta is a well-known dermatologist and has been practicing medicine for over many years now. She is MBBS, Mediskin, specializes in dermatology, cosmetology, and trichology. Currently, she is practicing as consultant dermatology at Mediskin, Nagpur. Dr. Sonam Sharda Gupta has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personal hair care services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Sonam Sharda Gupta is also aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to
Thank you
this
for having me
live
here.
show.
Thank you for having me here.
Uh, Dr. मैं सजन के लिए बहुत बहुत शुक्रिया. So today we are going to discuss about hair care in current scenario. So whenever we talk about hair care in current scenario, the very common problem which is faced by all of us is hair loss. So can you please enlighten us with your profound experience? What's normal when to be concerned for?
Fine. Let's starting with hair loss. Uh, Around shedding 80 to 100 hairs per day is very normal. And while you wash your hair, shedding 150 to 200 per day during your wash is normal. So if you are losing your hair in access to this, then it's a cause of concern. When people ask हमें dermatologist को कब visit करना चाहिए, अगर आपके नॉर्मल से ज्यादा बाल जा रहे हैं और यू see any specific signs ki you have a patch of hair loss or a lot of scaling itching in your scalp, that is when you should visit a dermatologist and you should be concerned.
ओके दैट्स वेरी इंटरेस्टिंग डॉक्टर सो डॉक्टर लाइक अब जैसे कि जिन लोगों को बाल गिरने की प्रॉब्लम होती है या फिर दोज हु आर प्रोन टू हेयर लॉस वो लोग अपने आप को ये पूछ रहे थे मेरे को ही क्यों हो रहा है मेरे को ही क्यों हो रहा है सो लाइक कैन यू प्लीज विद दिस प्लेटफॉर्म कैन यू प्लीज अवेयर अस लाइक व्हाट आर द जनरल कॉजेस ऑफ हेयर लॉस
Yes, there are like मैं most common causes पे I'll focus because there is an unending list of causes of hair fall. Then there are specific hair diseases. Some diseases are genetic. So we'll focus on more common causes of hair loss. Most common cause, especially in males, is hormonal hair loss. हमने काफी बार अपने पापा दादाजी चाचा जी फैमिली में किसी को तो नोट ही किया होगा कि they have this entire patch of hair loss. That is hormonal hair loss. फीमेल्स में भी मिलता है पर मेल्स में ये बहुत कॉमन है. इनिशियली आप कैसे पता कर सकते हैं? जब आपका हल्का सा यहाँ से बाल पीछे जाने लगता है, देन देयर इज आल्सो थिनिंग ऑफ स्कैल्प. इन एडवांस स्टेज पूरा पैच ऑफ हेयर लॉस हो सकता है. इसमें अर्ली डायग्नोसिस एंड ट्रीटमेंट इज वेरी हेल्पफुल. इन फीमेल्स दिस ये अलग तरह से प्रेजेंट करता है. यूजुअली लाइक देयर इज स्लाइट थिनिंग ऑफ स्कैल्प मार्जिन एंड यहाँ से जो हम बीच में पार्टीशन करके अगर आपको हेयर थिनिंग दिख रही है, दैट इज अ हार्मोनल हेयर लॉस इन फीमेल. So one of the most common causes hormonal hair loss. Second is nutritional deficiencies, like vitamin B12 deficiency, vitamin D deficiency, iron deficiency, trace elements deficiency. ये काफी कॉमन कॉजेज है, स्पेशली जहाँ इंडियन डाइट में हम लोग मतलब मोस्ट ऑफ अस आर वेजिटेरियंस और हम लोग एडिक्वेट क्वांटिटी में वी डू नॉट गेट न्यूट्रिशन. तो दिस इज न्यूट्रिशन इज अनदर कॉज ऑफ हेयर लॉस. Third, then there are some specific disorders, especially thyroid disorders, both kam wala thyroid and zyada wala thyroid, that is hyperthyroidism, may lead to hair loss. And then there are specific skin conditions which may cause hair loss, like psoriasis, dandruff is not so common cause of hair loss. Then there is lichen planus pigmentosus. These are all complicated terms, but ये भी hair loss का कारण है. One more thing, because this is monsoon season, there is slight increase in hair loss during this season, which is very normal. This is because of change in season and humidity. And then there is after pregnancy, लाइक जैसे हमने कोविड के बाद में काफी सिवियर हेयर फॉल दिया था, स्ट्रेस फैक्टर्स, अगर आप कुछ मेजर लाइक कोई सर्जरी होता है, सडन वेट लॉस करते हैं, क्रैश डाइट करते हैं, these are other causes of hair loss. because जब आप स्ट्रेसफुल पीरियड होता है एक तरह से ये बॉडी के लिए, तब हेयर का ग्रोथ रुक जाता है. तो आफ्टर 6 to 8 weeks there is sudden loss of a lot of hair. That is known as acute telogen effluvium. ये common causes है. Then there are fungal infections, some specific skin conditions which may also lead to hair loss. But I think these are common ones, so which people can easily recognize themselves.
Okay, that's very interesting, doctor. So nowadays, doctor, like we are living a lifestyle which is like very busy and no time to cook, and whatever we get, we eat. And we also like don't sleep on time, work late nights. So can a personal lifestyle play a role in hair health?
Definitely. I think three things which are very underrated. Even on Instagram stories, posts we see about supplements, hair gummies, shampoos, hair masks. But three things I think which are very underrated, both for your skin and hair, are your stress, your exercise, yoga, meditation, your sleep cycle. स्ट्रेस से डायरेक्टली हेयर लॉस नहीं होता है, बट डेफिनेटली देयर विल बी मोर ऑक्सीडेटिव स्ट्रेस which may impact your hair health and scalp health. Secondly, nutrition, as I already said, in our Indian scenario, it is not very well balanced. So healthy balanced diet is one thing. Your proper intake of your protein, iron, multivitamin, trace elements, green leafy vegetables, to some eggs, to milk, all of these are essentially required to maintain a hair health.
Okay, interesting, doctor. So, doctor, like now that we know कि hair loss क्या होता है, general causes क्या होते हैं, अब आज के time का जो
Sorry, I'm not I'm losing you. Can you frame your question again?
So actually I haven't asked the questions yet, but yes, कि आजकल इतने सारा information flow कर रहा है, तो people are confused कि क्या treatment सही है मेरे लिए, या क्या क्या options available है जो actually मेरे लिए बना है. So what are the treatment options available for hair loss, like surgical, non-surgical, or topical, or oral? Like how to manage this hair loss?
Actually, this is a question which has not a specific answer, because firstly you need to find out the cause. हर चीज का एक स्पेसिफिक ट्रीटमेंट होता है, बट ओवरऑल लेट मी टेल यू जो हमारे कॉमन कॉजेज होते हैं, बिकॉज कोई भी चीज में वी नीड स्पेसिफिक. अगर हार्मोनल हेयर लॉस है तो आर ट्रीटमेंट विल बी डायरेक्टेड टुवर्ड्स दैट. अगर न्यूट्रिशनल डेफिशिएंसी के कारण है, स्ट्रेसफुल पीरियड के कारण है, आफ्टर प्रेगनेंसी वाला हेयर लॉस है, तो आर ट्रीटमेंट इज डायरेक्टेड टुवर्ड्स दैट. बट फर्स्टली इफ यू आर फेसिंग your hair loss which is more than usual, firstly you should at least get these basic blood tests done, which include your hemogram, that is hemoglobin's complete blood counts, iron levels, vitamin B12 levels, vitamin D levels, thyroid levels check. These are very basic. जरूरी नहीं है आपका यही कारण हो कुछ डेफिशिएंसी के कारण, but they may coexist with other symptoms of hair loss, other types of hair loss, so that you can take your supplementation accordingly. Secondly, we do give hair supplements in any kind of hair loss, just to maintain a minimal nutritional supply. Then protein supplements are very essential. And then in topical, there are various medications which simply promote the hair growth. Coming to procedural part, there are a lot of options these days. you people must have heard of PRP, that is platelet rich plasma, in which we take your blood sample and separate the growth factors and inject in your scalp. It is a great way of enhancing hair growth, hair density, increasing the effect of treatment. Then there are variations of PRP like GFC PRP, growth factors PRP, mesotherapies. That is already a blend of vitamins, minerals, which is directly injected in your scalp. आजकल there are stem cells based treatments which are more advanced. There are already pre-prepared growth factors. I won't take the names because they are trademarked. There will be a conflict of interest. Coming to surgical part, so like you are talking about hair transplant, it is indicated primarily in two conditions. If you are having advanced hair loss where medicine PRP treatment won't work, or even after trying those treatment you haven't got that desired results. Secondly, there is one type of hair loss. Even females can go under hair transplant. It is absolutely safe. If you go to a trained doctor like dermatologist or plastic surgeons, it is absolutely safe and gives amazing result. And females can also undergo hair transplant. And secondly, there are some conditions in which hair root is destroyed. In those cases also we do hair transplant. It is absolutely safe and great treatment option for getting the desired result.
Okay, so that means it is very important कि पहले रूट कॉज पता हो और उसके हिसाब से ट्रीटमेंट हो.
Yes, because अगर आपको जैसे hormonal hair loss people have like everybody knows on Instagram we have to use minoxidil, but how it is used and people have misconception कि हम treatment छोड़ देंगे तो ज्यादा बाल झड़ेंगे, which is very very wrong. ऐसा नहीं होता है. आप treatment छोड़ देंगे. Minoxidil is a very common therapy we give in hormonal hair loss. In telogen effluvium, yeah, just common hair loss which we suffer after the stress, there are growth factor based, redensil, capexil based serums, growth factor based serums which are used. So I we have to direct our treatment towards cause. People come कि मैम हमने hair loss के लिए onion oil try किया था, हमने rosemary oil try किया, but it won't work for everybody unless you know the cause. Onion oil is not going to work if you are having hormonal hair loss. Rosemary oil is not going to work. Little bit it might be of little bit of help in because it has some good effects, but it won't target your primary cause. So knowing the cause is very very important. General treatment is waste of your money, time, energy. So please, if you are having any doubts, always visit a dermatologist for hair loss.
Okay, that's very informative, doctor. So, doctor, when we are talking about nutrients, there is a word called nutraceutical, which is getting a lot of focus nowadays. So, what is the role of this nutraceutical in hair health?
Nutraceuticals are basically like our medicine. The medicines we get are basically under some rules and regulations. Uh, in nutraceuticals, it is not that severe, matlab stringently managed. There are a lot of nutraceuticals containing biotin is one of the major ingredients. Then there are protein ingredients. Then there are some hormonal managing ingredients. So nutraceuticals is something which I personally don't. मतलब अगर आपका hair loss है, you want to try something, there is no harm. But if you don't know the brand, if you don't know what to take, if you don't know the exact composition, you keep when you come to doctor, you keep checking. मैम हम ये ले रहे थे, इसका ingredients क्या है? They don't know what they are taking. It is just a hair supplement, hair gummy they are taking. So nutraceutical is basically nutritional tablets or gummies which are not that stringently managed by a governing authority. So it is they are easily available to the patient through internet, through over the counter. They do not require prescription.
Okay, that's very interesting. So, doctor, there are so many helpful in these plant extract, like phytoconstituents. So, are they really helpful in promoting hair growth?
Uh, Actually, recent study, there is not a vast research and vast research on these, but yes, recently there are stem cell extract from various roots, from pomegranates to onion bulbs to everything.
Hmm.
Of yes, they target the what we need. I won't go into the specific scientific terms, but yes,
Hmm.
they are helpful. And अभी तो हम उसको एज एन एड ऑन थेरेपी लेते हैं, but yes, they in future they'll definitely play a big role in managing
Hmm.
hair loss, and maybe we'll get better result which we are not getting with medications in some patients. Yes,
Hmm.
they're absolutely useful.
Okay, very interesting, doctor. So, doctor, like there are so many macronutrients and micronutrients. So, with this, like
Sorry,
what should
I'm,
be?
I'm losing you again. Your voice is
Yeah,
breaking.
actually, I'm trying to say that there are so many macronutrients and micronutrients. So, can we tell our viewers through this platform like how to design a plate which is like blend of all the nutrients and what are these
How to
micronutrients?
design?
What are these micronutrients and what is the importance of these micronutrients in hair health?
Okay, fine. Uh, from macronutrients to micronutrients, our hair is built up of not just proteins. It requires various macronutrients and micronutrients to build that structure.
Hmm.
For that, and हमारे बॉडी में हर कुछ नहीं बनता है, तो हमें
Hmm.
कुछ चीजें बाहर से लेनी पड़ती है। और जैसे मैंने बताया, इफ यू आर नॉट टेकिंग हेल्दी बैलेंस डाइट, देयर विल बी डेफिशिएंसी। तो
Hmm.
बहुत बार फ्रिजी योर ब्रेकेज ऑफ हेयर,
Hmm.
स्पेशली ब्रेकेज, रफनेस, फ्रिजीनेस, और माइक्रोन्यूट्रिएंट डेफिशिएंसी और मैक्रोन्यूट्रिएंट डेफिशिएंसी में कॉज दैट। इसमें
Yeah.
2-3 चीजें हैं जो हम कॉमनली वो करते हैं। इफ योर जैसे हमारा हीमोग्लोबिन कम होता है तो योर हेयर विल सफर। सो
Hmm.
फॉर दैट, iron, vitamin B12 supplements, your protein supplements are important.
Hmm.
For that, you require a blood test. You cannot go blindly taking supplements. These are
Hmm.
macronutrients. For
Hmm.
micronutrients, you can go for selenium, magnesium. They all play important role. And most of the nutraceuticals or pharmaceutical drugs we have do contain a blend of them. You should know कि in what quantity we do not, actually हम लोग जो micronutrients होते हैं उनके blood test नहीं करते हैं, because
Exactly.
they're not easily available and they are very expensive actually. So
Hmm.
usually we choose a nutraceutical or pharmaceutical hair supplement which has a blend of both, and we
Hmm.
keep changing it sometimes so that you get best of every medicine or every drug or every supplement, so
Hmm.
that you can get सारे जो भी micronutrient है उसका sufficient quantity. But these the ones I stated are very important for your hair health and scalp health.
Okay, doctor. So it's very important to take these nutrients and it's always better to ask doctor and then take it.
Yes, definitely, because Instagram पे I think Instagram has ruined everybody, और it is
Yeah.
great, information है, सबको पता है, बहुत अच्छी चीज है, बट क्या लेना है उसमें से? अगर आपको, like I always tell my patients, अगर आपको कुछ, if you are not facing any major issues, कुछ नहीं है, just to maintain hair health, you can try any supplement from a good brand or a trusted brand, that is okay. But if you are facing a specific problem, then
Hmm.
you should go to a dermatologist and consult. But if it's just a minor up and down, minor hair loss you are just taking,
Yeah.
you can take through, well, once you find good or your friends or through someone, you can take that. There is no harm.
Yeah. So, doctor, after hair loss, there is another common problem which is dandruff. So, how does dandruff play a role in hair health? Does
In
it
hair health or hair
hair
loss?
fall?
Hair fall.
Yeah. Yeah.
Okay. Dandruff doesn't directly cause hair loss, let me tell you. First thing, there are two things. There is a fungus known as Melissia, responsible for. Hey, is there? Huh.
Yeah.
There is a fungus known as Melissia, which has a big role in dandruff. बेसिकली दैट फंगस कॉजेज ऑक्सीडेटिव स्ट्रेस, मतलब ये बहुत कुछ केमिकल्स या रेडिकल्स प्रोड्यूस करती है विच डैमेज योर हेयर। तो वो स्काल्प हेल्थ, आपकी हेयर हेल्थ को डैमेज करता है बिकॉज ऑफ दैट ऑक्सीडेटिव स्ट्रेस, विच
Mm-hmm.
लीड्स टू नॉट जस्ट हेयर फॉल but premature aging of hair. You can see the rough, dry hair in dandruff, and it may lead to hair loss, but not always. Secondly, if there is vigorous itching, like in dandruff in some patient, it may also lead to breakage and hair fall. So these are two major things which in dandruff that may lead to hair fall.
Okay. So, doctor, like when we have dandruff, we tend to apply oil. So, oiling hair is boon or a ban?
Okay, it has two sides. Let me tell you the good oil and bad oil for dandruff.
Mm-hmm.
Mineral oils, coconut oil, they work as food. मतलब वो जो फंगस है, आई जस्ट टोल्ड यू अबाउट मेलिसेजा, जो डैंड्रफ में मेजर रोल प्ले करती है, बेसिकली उसके लिए खाने का काम करते हैं। तो कोकोनट ऑयल, मिनरल ऑयल आर एब्सोल्युटली नो नो फॉर people suffering from dandruff. You can apply them 1 hour before your hair wash, and mainly over your ends to condition your hair, but I'll say to avoid your scalp. Tea tree oil, on the other hand, is has anti-inflammatory property, has anti-dandruff property, but beware, it has slight irritant property also. तो अगर आप यूज करते हैं बट फॉर योर डैंड्रफ, बट इफ यू आर फेसिंग इचिंग इरिटेशन, तो यू नीड टू स्टॉप यूजिंग इट, अदरवाइज इट इज हेल्पफुल इन डैंड्रफ। सो
Okay.
बेसिकली
Now,
आप
doctor,
कौन सा
my favorite.
बेसिकली आप कौन सा ऑयल चूज करते हैं फॉर डैंड्रफ, दैट इज इम्पोर्टेंट।
Okay. Okay. So, doctor, now my favorite part. Can you give us some important tips for healthy hair?
हेल्दी हेयर, although I have already said healthy, balanced diet, in few studies it has shown that fruit-based diet, green leafy vegetables, nuts, has improved scalp health and hair health. Maybe because they contain antioxidants, some vitamin A, and proper micronutrients, macronutrients. So they have improved health, hair health, and scalp health. You should check your protein intake, 1.5 to 1 gram per kg of your body weight. Third, wash your hair. Choose your shampoo depending on your hair. अगर आपके बहुत बहुत, it is not everybody shouldn't be using sulfate free shampoo. If your scalp is very oily, if you exercise a lot, it is sweaty, you need to use a sulfate based shampoo for proper cleansing. But if you are having very dry scalp और बहुत बाल भी rough frizzy है, तो choose a sulfate free shampoo because it is gentler on your hair. Always use a conditioner because I think many of the Indians believe कि conditioner से बाल टूटते हैं, बाल खराब होते हैं, which is a very big misconception. To maintain your hair health, to keep those cuticles, जो आपकी बालों की बाहर की लेयर है, उन्हें स्मूदन आउट रखना ताकि वो रफ फ्रिजी होके, फ्रिक्शन होके ब्रेकेज नहीं हो, यूज अ कंडीशनर. इफ यू स्टिल फील कि योर कंडीशनर इज नॉट इनफ, use a good hair serum, silicone based. एंड सेकेंडली वी हैव, बचपन से हमारा टाल ड्राई करने का आदत हो, हेयर को ऐसे ऐसे करके, ऐसे ऐसे करके, और लड़कों का तो आदत होता है. प्लीज डोंट डू दैट, डोंट रब योर हेयर, डोंट create that friction. Use a microfiber towel or a gentle or a cotton t-shirt to gently uh, absorb that excess of water.
Mm-hmm.
I think three things: health, your diet, what
Mm-hmm.
products you use, a proper conditioner or serums, and your exercise. I think these are all things which help maintain a healthy scalp. And then there are so many things, like if you have a very frizzy, dry hair, you can go for deep conditioning treatment once in a while. Avoid excess use of heat, not very frequent straightening, hair botox, hair keratin. They'll all damage your hair in long run. So if you are doing it once in a while, that's okay. If you are trying to repeat it every 1 to 2 years, your hair will be damaged for a long time.
That's very interesting, doctor. This discussion was very informative. So now, can we take some live audience questions?
Sure, sure.
And the first question from our viewer is, hi डॉक्टर, मैं मेनोपॉजल एज में हूँ, मेरी एज 50 है, मुझे बहुत हेयर फॉल हो रहा है, उसके लिए क्या करना चाहिए?
Uh, there are three things. If you are menopausal in this age, hormonal hair loss is very prominent. So I think to diagnose that, you should first visit your dermatologist, because during perimenopausal age group, hormonal hair loss is biggest concern among all the females. Secondly, as I said, you should go for the routine blood checkups like hemoglobin, iron levels, B12 levels, other vitamin levels, and thyroid levels, to make sure you are not facing any other issues. These are two things you should do. Then, once your results are out, and if it is hormonal hair loss, you will need properly to take treatment for around 8 to 9 months. And fourth thing, which is most important, जितना आप जल्दी दिखाएंगे उतना जल्दी उसका प्रोग्रेस रुक सकता है, एंड उसका बेटर ट्रीटमेंट रिजल्ट मिलेगा आपको.
हाँ, correct. Another question from our viewer is, hi डॉक्टर, मेरे को डायबिटीज है और मेरे को एंडोजेनिक एलोपेशिया भी है, क्या मैं हेयर ट्रांसप्लांट करवा सकता हूँ?
Yes, definitely. Why not? The only thing should be आपका शुगर कंट्रोल में होना चाहिए, just to prevent the infection, मतलब post procedure infection. Otherwise, it is absolutely safe. Even if you are hypertensive or diabetic, जो भी आपके parameters है should be absolutely under control.
So fine, doctor, would you like to give any take-home message or any other suggestion to our viewers today?
Yes, definitely. I like to give two to three things. Firstly, for hair health, healthy diet. Don't underestimate it. It is very important. Heating, for especially because of this generation, usually 20 to 30 years females are very common patients. Use a minimize the heat styling as in when needed, not more than once every 10 days. And botox, keratin, whatever hair treatment is a no unless you plan to do it just once in every decade. Third thing, never skip your conditioner, hair serum. Use lukewarm water to wash your hair. Just keep your the, I think hair is beauty, because it makes a lot of difference if you have good hair. So please make sure to take care of them as like they are going to stay with you for a long time.
Thank you so much, doctor. Thank you so much for sharing all your expertise and so much of information with us today. I'm sure the viewers have found the session very helpful. Thank you so much, doctor. It was a delight to have you, and thank you so much for your valuable time.
Thank you for having me here on your platform to share whatever tips. I hope at least some of the people or people watching this will find this useful. Thank you so much for having me here.
Yes, doctor. Thank you so much, and thank you so much, ladies and gentlemen, for joining us today and answering and asking so many questions and participating for so actively. Um, Next time we'll come up with a new topic and create more awareness if our doctor have time in future. Until then, let's sign off for today.
Okay, thank you.
Have
Bye.
a nice day, doctor.
Thank
Yeah,
you.
thank you.